Welcome to the MS&Me Radio Network, a division of the Multiple Sclerosis Global Support Network. The following program broadcast is an original creation by the broadcast entity. Discussion within the following broadcast should be used for informational purposes only and is not a substitute for professional medical advice or consultation. Before considering application of any broadcast content in the following program, please consult your healthcare provider. If you feel you are having a medical emergency, please contact your local health services for immediate assistance. MS&Me Media and the Multiple Sclerosis Global Support Network do not guarantee or warrant the accuracy of information in the broadcast to follow. The Multiple Sclerosis Global Support Network provisions broadcast services to program hosts. Information discussed in the broadcast does not necessarily reflect the views, opinions, or goals of the network and are solely those of the show broadcast host. Should you wish to host a broadcast, please visit our website at msmemedia.com and submit a request to become a program host. We thank you for listening to the MS&Me Radio Network. Enjoy the show.
Hi, welcome to this broadcast of Living Wise with MS. I'm your host, Kim Freiling-Resar. First, I'd like to thank MS&Me Radio, along with the Multiple Sclerosis Global Support Network, for this amazing opportunity. I'm so excited to be a part of this initiative, bringing together the various MS voices to spread awareness and offer support to the greater MS community. The goal of this show and every Living Wise with MS broadcast is to empower people living with MS to live the best possible lives they can. I've been living with MS since 2003, and living wise means so many different things and to so many different people. With each broadcast, I hope to address the various components that make up the big picture, the total picture of what it means to live the best possible life you can with this chronic illness. Before I get started, though, I want to mention, as I do with every broadcast, I want to stress how important it is that you are the one that finds what works best for you. MS is such a variable disease, and although there are many similarities to what each of us experiences with this disease, what works for one person may not work for another. So I can't tell you how important it is that you take everything people say, including me, with perspective. I know everyone means well and everyone's trying to help others with this disease and support each other. And there's people out there who try to tell you what worked for them that you have to try because they want it to work for you. But I have to say that you need to take it all with a grain of salt and try to focus on and discover what works best for you and only you, which is a great lead-in to the topic of this broadcast. Today I'm going to talk about how important it is that you're in charge of your health care. So what do I mean when I say that you're in charge of your health care? I guess I believe that as people with a chronic illness, we need to be the ones who are kind of leading our treatment plans, our overall care of our own health. So I wrote a blog post about making sure that you're the quote unquote CEO or president of your healthcare. And of course, when I say that, you need a team. When every CEO, every captain, they need a team, and they're only as good as their team members. So of course, when you're in charge of your own healthcare, you're doing this in conjunction with your team. And you can have your home team, which obviously is your family and friends, but you also need your healthcare team. And your healthcare team can consist of a lot of key players. So you have your neurologist, your primary care physician, your MS nurse, your physical therapist, your ophthalmologist. You've got all these people. But ultimately, the most important member of this team is you. You are the captain, the CEO, the president, whatever you want to call it, but you are the leader. You are in charge. You are the head of this whole thing. At least you should be. Because living with a chronic illness can make one feel so out of control. And I think it's important for us to find ways to take charge and to play a vital role in our own overall health care. I know when I was first diagnosed and feeling so out of control or out of power that MS and my neurologist had more of the power, I looked to them to have the power. Um, that it, my healthcare was not doing well. So at least for me mentally. So there's a couple things that I do to make sure that I'm kind of making sure I'm performing in that lead role and that CEO role of my healthcare. And simple, just simple things. One way that a simple way of making sure that we're prepared for any of our appointments or checkups. So we really want to take that time and maximize it with our neurologist or our MS nurse or whoever we may be meeting with on during that doctor's appointment. As we all know and have experiences, doctors' offices or MS clinics can be extremely busy. They can be backed up. They can um, be running behind, and it's sometimes we may get limited in our time. So we really need to maximize it and make sure that we're utilizing that time to the best of our ability. So I like to think of those checkups kind of like a business meeting. Much to the chagrin probably of my neurologist, I come in with my notebook and I'm acting kind of as president and CEO of my health and here I am meeting with my key members of my team. This business meeting is about me, about my health and in fact about my life. So it's truly important that I take advantage of this time to confirm that I'm on track and managing this chronic illness to the best of my ability. So in preparing for that, so one of the keys would be preparing for these appointments. I mean, like we all know that sometimes our healthcare provider tries their best to hear us out and to spend the time with us as much as they can. But I know that we've all probably experienced moments where we feel like we're kind of being shuffled through because for some reason or another they are running behind. So I found just preparing for these appointments, I keep a health journal. And keeping a health journal is helpful, I have found, so you can reference it during your appointments, so you don't forget anything during your appointments. Um, I use it to jot down notes or even answers to any of the questions that I may have had during the appointment. And I use my health journal track I track anything and everything that I personally feel is worth noting. I found it that keeping track of this stuff I've started very early in the course of my disease, and I've found that by doing so, I've really become in tune with what's going on inside my body, and how I'm doing throughout time. And here's some of the things that I keep in my personal notebook. I keep a track of symptoms or relapses. So I have a calendar and I write down if I experience something different or if I'm feeling off in any way on any particular day. And the things I write down, it might not be MS, but it can't hurt to make note of it. And that also keeps me aware that there's other things going on inside my body and not just MS. And as we know, we have to take care of those other things as well. It's truly important that we don't lose sight that there's other things going on and that we also need to manage them as well. There's a lot of people with MS who have secondary conditions as well that they need to maintain. So it's truly important that for our overall health that we're also aware of that. I also keep a running history of when I've had flares or exacerbations. So again, this is for that overall picture of how I'm doing over time. And this tracking's really kind of helped me get in tune with how I'm doing with the disease. And also, it's even revealed to me things such as it seems that I'm more likely to have a flare during the winter months. And I know this because I've kept track and I can see through the calendars of when my relapses happen. And it's interesting also to look back. You can see when they happen, if maybe they were stressful times in my life, and you can see how one thing might correlate to another with your health. Other things that I track in my health journal are how I'm feeling mentally or physically. Every day I make a quick note. If I'm if I'm feeling more fatigued that day, perhaps depressed, feeling down, I can see maybe trends in how I'm feeling over time. If I'm anxious, or if I'm having a foggy day where I'm not there cognitively and I'm having a hard time thinking, or days that I'm just frustrated, anything, just the way I'm feeling that day. And I know if I look back and I see that there's days that have nothing written down, then that was probably the day I was feeling okay, or quote unquote normal, or whatever, the normal is for me these days. So if there was nothing there, then that was an okay day. And I also like to track my exercise. So tracking my exercise keeps me on track. It keeps me motivated. I know if I'm sticking to my exercise regime when I'm writing it down, so I know I'm not slacking off. And I found that when I exercise, I just feel better overall, both mentally and physically. So it's an important part of my routine. So I make sure I'm tracking it so that I'm staying on track. And it's interesting too. So when you track your exercise, you can see how it affects your mood. You can see how it affects depression, anxiety. So it's an interesting, again, you get that overall picture. Another thing that I track are my medications and my supplements. So I track the dosage, the time and day, any possible side effects that I may experience, um, some random thing that may happen during taking the medication, or something, just anything that might have been off. And this was especially good to track this when I was on the injectable medications, because I would track the injection sites to make sure I was rotating properly, not hitting the same spot too many times. Also keeping track of, which medications I've been on over the course of time, even IV steroids that I may have been on during flares. And again, just any supplements that I may take, my vitamin D, my multivitamin, um, even I've been on biotin and other supplements, but just keeping track of them to make sure that they're not going to interact or interfere with any other medications that I may be taking, an antidepressant, or um, any of the other various drugs that you may take for other symptoms. You just want to make sure that they're because supplements can interact with medication. So you want to make sure that your healthcare provider is aware of those so that you can prevent that from happening. So taking taking track of all these medications, that helps me, I think, just to see maybe what's working, what's not working. And I think it would also helps me with any future treatment decisions that I need to make. If I need to, well, the IV steroids have worked for me in the past. If I experience a flare, I know they've worked in the past because I have track of it. We can, go ahead and do that again, or I'd be more open to doing that again. I also write down any questions or concerns that may have come up since my last appointment. And again, this appointment's about me, and I really feel like all my questions and concerns should be addressed. And I don't want to walk out of that appointment and realize, oh, I forgot something. So it's nice to have that reference there that you can look at. And another part of it, which I hate to admit, but we tend, at least I tend to be forgetful. So having those reminders there and those things that I want to cover during that appointment is important, and to make sure that I'm on track. And if, keeping a physical notebook doesn't interest you, there's plenty of mobile apps and tracking apps out there that you can track anything, and um, just just to be aware and to keep track of all those things like exercise and mood and injection sites. So keeping a physical notebook doesn't interest you, again, there's plenty of mobile apps out there that you could find. Um, a second way that I think is good for appointments, especially when you're newly diagnosed, is having someone there with you. I think having someone there with you on these appointments is always good for support. And of course, it's always nice to have company on the ride if there's a ride or commute to your MS clinic or your neurologist. And there tends to be, as we all know, times that we have to wait in the waiting room a little bit longer, and it's always nice to have someone there with you. But I think most importantly, this person can serve an even greater role than just being company. Having another person there with you and to sit in on your appointments ensures that you're hearing all the information from your healthcare provider. I think sometimes we have a tendency that we might hear just one part of the appointment, and we might focus too much on that one detail. I know for myself personally, sometimes if I hear one tidbit, maybe I'm just using an example about maybe there's a new lesion that was discovered on my MRI. That might be it for me. I might focus in on that one topic that she just told me and not hear the rest of the appointment. And for that, you might miss things. You might miss. It might not be a negative. There might be something else that kind of clues into what she was saying. But again, um, having that other person there, make sure that you're hearing all of the information and you're hearing it, interpreting it correctly. So what I do personally too is I have a ride or a bit of a commute, about an hour ride to my MS clinic. So I like to do what I call the post-game analysis with the person that I took to the appointment. And that's just kind of a reassessment of the appointment, just a discussion of, what did you get out of the appointment? What did you think of it? Ask the person their interpretation and what were the key takeaways that they got from the appointment? What was their overall impression? They may have picked up on something that you didn't, maybe something that you missed, or maybe you focused in on one minor detail and didn't hear something else, or you interpreted something different than maybe they did. So, I found it is really useful, especially in the early days, to have that other person with me. I was dealing with a lot of emotions when I was first diagnosed, and a lot of emotions that I couldn't necessarily sift through so that I could concentrate on whatever the key components were of that appointment, what the key takeaways were. And another way that I feel that you can act as CEO of your health, in addition to being prepared for those appointments and making the most of your doctor's appointments, is participating in the decision making about your treatment. Now, when I say this, I don't mean take over the decision making for your treatment, because like the team aspect, you really do need to have input from your entire team, and you need to take into consideration what they have to say. And in that, you do need to have good, open communication with your healthcare provider. And I truly feel like if you're not comfortable discussing your illness or the various symptoms that you may have with your healthcare provider, that it's truly important that maybe you switch up and find someone you are comfortable talking with. I think with MS, there's many symptoms that we may experience that may be perceived as embarrassing, such as bowel and bladder issues, even sexual issues, relationship issues. There's a lot that might not be comfortable to discuss. So it's truly important that you feel comfortable with your team, with your healthcare provider, that you can share these things with, because there may be strategies and maybe treatment options to overcome these symptoms, but you won't know about them unless you discuss them. And again, going back to the appointment, taking advantage of the appointment, it's truly important that you do discuss them so you can overcome them and live the best possible life you can. So don't be afraid to try someone new if the person you're seeing you're not comfortable with, because it's truly important that you do have that open, good communication, because this is your team and they're all should be fighting for the same goal. And that same goal is you being the best possible person you can be, living the best possible life you can live, and overcoming any of these symptoms or side effects or anything. So again, don't be afraid to try someone new if the person you're seeing is not clicking with you, if you're not comfortable with. And someone that you can kind of collaborate with and discuss treatment options and have your questions answered. Um, and I think to be an active participant in the decision making, you need to have that good rapport with your healthcare provider. I'm going to share a personal story about, a shared decision making that I personally went through, and it was concerning treatment options. And um, when I was deciding to switch DMTs, I had been on injectable medications for the past 12 years, and I had success on them, but I also didn't necessarily adhere to them. I was having relapses during them. I was suffering side effects with them. But at the same time, I was kind of attached to the injectables because in my way, that was part of my regime. It was part of my routine. It was part of my fight against MS. And I was scared to give them up. I was scared to try something new. As with everything, change is a scary thing, especially with a chronic illness, because there's so many unknowns about how you're going to respond to something personally. Um, and there's risk there. So it's scary to try something new and to have that presented. So I'm kind of going a little off a tangent here, but when I was diagnosed, basically I feel like I was told which medication to try, told which medication to go on. I didn't really feel like I was an active participant in making the decision on the treatment option. And now, I mean, we're in a great age now with all the various options that we have, from injectables to oral to infusion. It's great to find the one that works for you. So that's, I think, in that decision making, in that change, I had to be the one ultimately to make the decision, and I think that helped me. It was a process, of course, that I had to go through, but I had to weigh all the personal things, my personal life, my family, my work life. How was this medication going to affect all of those, and which of all of these options was the best personal one for me? So finally, I did decide on taking one of the oral medications, and that one fit perfectly with my lifestyle. But ultimately, I was the one that had to make that choice. Now, I think it took me close to 2 years to come to that decision. And I listened to what my healthcare provider was saying and discussed it with her. All of the various options, pros, cons, all of that. But ultimately, I was the one to say, no, let's try this one. Ultimately, that was my decision. She might have felt differently. She might have thought of a different uh, treatment option, might have been better for me. But me personally, this one fit best. So in a way, that was very empowering for me to make me feel like I was more in charge, acting as that CEO again, that I was truly involved in making decision making for for my own personal healthcare well-being. Um, Now, that's just one example of the decision making. But I also think it's truly important, living with this chronic illness, that we stay educated about it, that we keep up to date with all the latest news about multiple sclerosis. But I also always caution just to consider the source. Always consider where you're getting your information and try to seek out that information from reputable sources. Sources like the National MS Society are great, reputable resources. Even the site that I contribute to, livewisems.org, is a great site where all of the information that has been reviewed and vetted by healthcare professionals. In particular, on livewisems.org, they've been reviewed by nurses, MS nurses, that are a part of the International Organization of MS Nurses. And I don't know about any of you, but I found throughout the course of my disease, from since the time I was diagnosed, some of the most valuable information I've received have been from these nurses. The nurses, the IV nurses, the MS nurses at the clinic. They're truly in touch, with the disease and with the patients and the experience. So what better place than to get your information from these nurses? So like I was saying, I think it's extremely important to stay educated, to understand what MS is. I think that's one of the ways that we can kind of, it becomes less scary and we gain more control back over it if we understand it and know what's going on and what's happening inside of our bodies. To me, that's one of the best ways to empower yourself to fight against it, is to know about it. That knowledge is power. And to just remind you that you're in control. You are in control. MS is not in control of us. It's like that famous saying that we've all used at one point or another in our course. I hope. If not, you're going to say it. Is that MS? We may have MS, but MS definitely does not have us. So again, just there's simple ways keeping track of your overall health in a notebook. That's something very simple that I've found, just to keep myself prepared for the appointments, to participate in the shared decision making with my provider, to have that open communication with her. These are all just simple, easy ways that we can kind of give ourselves back a little bit of that power over MS and to make us feel in control. Stay educated, consider the source, take everything with a bit of a grain of salt, but ultimately you are in power and never forget that. And this is why I feel so fortunate to be sharing my insights and my story with you. And I'm so lucky to contribute to the MS&Me radio station, as well as to contribute to livewisems.org. I truly believe it's a wonderful MS patient resource site. Gives you patient summaries of clinical content, and it's all reviewed and approved by professionals, nurses from the International Organization of MS Nurses. So I'd love for you to join me again on one of my Living Wise with MS broadcasts. We will explore many different ways that we can truly empower ourselves over this disease. I would love to hear from you. If you could please reach out to me. You can email me at editor@livewisems.org or through the livewisems.org social media sites on Facebook, Twitter, Google+, LinkedIn, and Instagram. So please join me next time as I continue to discuss how to live wise with MS and ultimately live the best possible life we can with MS. I truly believe we can do it. And I know, and I'm going to say this probably every time, because if you say it and believe it, it'll happen. There will be a cure. Until next time, all of you be well. Thank you.